Hi, this is the Agape Project, and I'm author and minister Cynthia Middlebrooks Harris. We left off last week with giving you the test that you can take to determine if your loved one is actually suffering from dementia, or if you think they may be suffering from dementia or Alzheimer's. We're going to pick up this week and continue on with treatments and prevention, and we're going to get a little bit more into the stages of Alzheimer's and into brain tumors. So if you're joining us for the first time, this is a page that we have put together at Tosat Ministries to help those that are caring for loved ones that have ailments such as dementia, Alzheimer's, they've had a stroke, they're handicapped, or whatever, a forum where we can get together to come together to have our loved one lifted up in prayer, and that we can support one another, and we can encourage one another, and we can equip one another with ideas, things that are working for us, things that didn't work for us. So this is just a page where we can do those type of things. So we're going to pick up where we left off at on last week's session. This week we're going to start out with treatment and prevention. First of all, brain cell death cannot be reversed. So there is no known treatment or cure for a degenerative cause of dementia symptoms or to fully halt its progress. Unfortunately, it's something that cannot be reversed. But like I said in the last segment, I serve a God that is able to do exceedingly and abundantly above all that you may ask or think, according to the power that works in us. I pray for my mother nightly. I anoint her, and I say, God, if it is your will that you change her situation, then I am believing you for that. But if for whatever reason this is not going to be something that's going to work for her, then I accept that as well. And I know that sounds really kind of blind faith like, but it is God's decision. He has sustained her life with this tumor in her head for 20 years, and he is able to continue to sustain her life just the way she is now. And I'll get a little bit more into that in the next session, but I don't want to take this session up talking about the spiritual side of this. We want to wait. We want to get the technical side out of the way and then get into what the Agape Project is all about, God's love and power in taking care of your loved one. But we have to, first of all, take care of just equipping people with what's going on here. So dementia symptoms are due to a reversible non-degenerative. If dementia symptoms are due to a reversible non-degenerative cause, however, treatment may be possible to prevent or halt further brain tissue. Example, injury due to vitamin deficiency, or you had a head injury that wasn't like life-threatening. If you don't keep on getting the head injury, then you probably will be okay. Like it's in the same instance as we said in the last segment with sports athletes who are repeatedly getting hit in their head. Prevention. We get on into prevention. There's something that you can do actually in your life other than a brain tumor or head injury that could actually prevent or put you on the low risk side of actually developing dementia in your lifetime. Smoking and alcohol use. High levels of bad cholesterol. Keep your cholesterol under control. Diabetes, which is a risk factor for cardiovascular disease and stroke, which may lead to vascular dementia. So there's things that you can do. Basically, you need to be healthy. If you're a person that really eats a lot of fast food and fattening foods and fried foods, you may want to bring those down, and a lot of sugar intake. You may want to control those things, control your cholesterol, control your sugar levels, and not be a drinker or smoker. And these things will actually lower your risk of having brain cells damage and cognitive impairment in your lifetime. Okay, now we're going to move a little bit more on into Alzheimer's disease and really kind of break that down just a little bit. Alzheimer's disease is the most common form of dementia. So while Alzheimer's is not actually dementia, it is a form of dementia, and it actually leads to death, where dementia itself does not actually lead to someone actually dying, but Alzheimer's will eventually take the loved one's life, and at a pretty quick time after it's been diagnosed. There's no cure for the disease. It worsens as it progresses and eventually leads to death. It is first described by a German psychiatrist and neuropathologist. His last name was Alzheimer's in 1906, and it was named after him. In 2006, there was 26.6 million people worldwide with Alzheimer's. Wow, this is one of the things that led to my life. Taking care of my mother really led to my lifestyle change. Back in March of 2014, this year, I decided, one of my friends, Minister Shondaland Hall, challenged me to do a green smoothie detox with her for 10 days by JJ Smith, a book by her. And after I detoxed myself, I felt so good. I actually lost 13 pounds, and I felt so good, I had so much energy. I didn't want to retox my body again. I decided at that point to become a vegetarian and to begin to eat extremely healthy. I have lost almost 30 pounds since then. My cholesterol was high. I had high blood pressure. I have since then been able to control my blood pressure, and my cholesterol is lowering. I went to the doctor and he wanted to put me on Lipitor. Well, that was enough for me. At that point, I thought, you know what, Cynthia, it is time to make a decision to change. And then taking care of my mother just solidified it for me. I need to be healthy so I don't do this to my loved ones, and I take care of myself. So you cannot, there's certain things you can't avoid. You can't avoid head injuries, and you can't avoid developing a brain tumor. But you can lessen your risk of developing one, and you can lessen your risk of developing dementia if you first off just practice being a healthy person. Now, although Alzheimer's develops differently in every individual, there are many common symptoms. Early symptoms are often mistakenly thought to be age-related concerns, as we said before. Mood swings, short-term memory loss, confusion, not really remembering what you did yesterday. Those are all things that people can just say, oh, well, she's just senile, and they may actually be the onset of Alzheimer's or dementia. So if your loved ones is experiencing these things, have them tested. Go ahead and get the CAT scan, to get the MRI, because you really want to make sure that it's not just your loved one, getting a little bit older and getting a little bit senile, and make sure that it's not actually dementia or Alzheimer's. But if you get them on medication soon enough, you can actually slow down the process of what's going on with them, and they can have a vibrant life a little bit longer. So everything is kind of worth it. There's 4 stages of Alzheimer's. There's a pre-dementia stage, there's an early stage, there's a moderate stage, and the advanced stage. Then the pre-dementia stage, the first symptoms are often mistaken for the aging process. Like we said, they just simply begin to forget a few things, and they kind of start having problems putting things together. That's the pre-dementia stage. Now, the early stage in people with AD their impairment increases. The memory actually leads to a definitive diagnosis. In small portions of them, difficulties with language, executive functions, their perception is off. The executive movements are a little bit more harder for them to move. They need a little bit more help. Their vocabulary decreases. In the moderate stage, it gets a little bit, the progression deteriorates a little bit more, and it starts to really hinder their independence to live alone, which sometimes forming daily tasks is a problem. Cooking for themselves, forgetting that they left something on the stove. Difficulties with become evident because they cannot recall vocabulary. They start getting to where they can really just not really speak as well. They don't remember the words to say. Their behavior changes. Their mood swings get to be a lot more and a lot more apparent. They're moving into the moderate stage. 30% of people with AD illusionary misunderstandings. They're misunderstood for being delusional, but actually they have Alzheimer's disease. Sundowning will affect them a lot. My mother has sundowning a lot. When the sun goes down, she gets real lethargic sometimes, and you need to be ready to put her in the bed, because she's gonna pretty soon, not even be able to help you get her undressed almost. Their behavior changes. They cry. They have outbursts of anger and aggression. This is the moderate stage. The advanced stage this is during the final stage of Alzheimer's disease. The person is completely dependent on the caregiver. Language is reduced to simple phrases and even sometimes just simple words. It eventually leads into a complete loss of speech altogether. Despite the loss of verbal language, though, you can still be able to communicate with them, through some kind of emotional signals. Although aggressions can still be present, extreme apathy and exhaustion are almost common results. People with Alzheimer's disease will ultimately not be able to perform even the simplest task without assistance. Muscle mass and mobility deteriorate to the point to where they're bedridden, and they lose the ability to feed themselves. AD is a terminal illness, and the cause of death typically being an external factor, such as the infection or pressure ulcers or pneumonia or the disease itself. Now, in my mother's case, she has a brain tumor. That's why she is deteriorating. And that's why she's losing her bodily functions, because the brain tumor is actually on her brain stem now, and it's actually beginning to cut the fluid off, flowing through her brain stem, which will eventually shut her down. But she does not have Alzheimer's. She has dementia. The cause of Alzheimer's is still not unknown, and they're actually saying that some of it is actually genetic. The genetic terminology was so difficult that I'm not going to begin to try to explain it on this tape. You're going to have to look it up yourself. Now, we really want to talk about the caregiver. It is very important that the caregiver gets their support team. You need to make sure that you count up the cost before you say, yes, I'll take this person into my home. Ultimately, the person does do better if they're at home with their loved ones, but the role of the main caregiver is often a spouse or a close relative. Alzheimer's disease places a very financial burden on the family. It can cost anywhere from $18,000 to $77,500 per year in the United States to take care of someone that has Alzheimer's disease. And there's so many associations that will help you. Like I said, hospitals will usually and Medicare will usually pick up the bill for the bulk of that. But there are still some financial demands that would be on the spouse and on the family. You also need to make sure that the person they may walk in and sleep at first. They may hallucinate at first. They may go in the middle of the night, turn the stove on to attempt to cook something. So it is really a work in progress. You are not probably going to be able to work outside your home if you're taking care of a loved one with dementia or Alzheimer's. It's going to be impossible for you to leave them home alone, because you may come home and the house is burnt down with them inside of it. So you really are gonna have to make a decision to quit your job to take care of them if this is what the route that you choose to take, or hire a nurse to be in your home with your loved one while you're at work. Now again, there you run into the expense account again, because hospitals and Medicare will not pay for that. That is going to be on your family should you choose to take that route. In my mother's case, she has a brain tumor. I'll get a little bit more into her brain tumor on the next session. I guess I could go ahead and do a little bit of it now. Brain tumors can occur at any age. Now, the one that my mom had is called meningioma, is what she has. And it's about the size of a small plum located right behind her left eye. My mother really shouldn't be able to see. She should be blind, and she should have already been dead by now. So I know that God is a sustainer of life. Brain tumors can occur at any age, and the exact cause of brain tumors is still not clear. Physicians group brain tumors by grade. And the way the cells look under a microscope. They're in grades 1, 2, 3, and 4, depending, I guess, on the abnormality of the cells and how they appear. The symptoms of brain tumor depend on the size and the locations. And there are some symptoms too that someone may have a brain tumor: numbness and tingling in the arms or leg, seizures, memory problems. My mother had seizures, and that's memory problems. That's what prompted her to get her MRI. She actually ended up in the hospital 75% brain dead for 30 days back in 1994, and that's when it was diagnosed that she actually had a brain tumor and dementia. Personality changes, balance and walking problem, nausea, vomiting, changes in speech, vision, and hearing. Brain tumors are diagnosed by the doctor based on the results of a medical history and physical examination and results of variety of specialized tests of the brain and nervous system. Treatments of brain tumor depend on the type, location, and size of the tumor, as well as the age of the patient. At this point, we're going to cut this video off, and next week when we come back, we will begin to talk about getting together, talking about foods, opening up the forum for people to be able to say, hey, this is what my loved one has. I need help. Thank you for this page. We'll be talking about different things that you can help your loved one with, different things that they can eat or not eat. So when you join us next week, we'll start to get into the ministry and the spiritual side of taking care of a loved one with dementia, Alzheimer's, handicap, stroke, or some other type of ailment or term illness. Thank you for joining the Agape Project. This is God Ordained Tosat Ministries. Minister Cynthia Harris, and my husband, Minister Kim Harris. We thank you for joining us and being a part of this love project that God has ordained us to put together. God bless you, and we'll see you next week.